Hello, everyone, and welcome to Healthy Talk with BCH, empowering your wellness one conversation at a time. I'm your host, Rachel Mann, and today we're diving into the world of radiology at Boone County Hospital. We have a special guest with us, someone who knows the ins and outs of the radiology department like no other, Radiology Supervisor Amy Bachman. Amy, welcome to the show.
Thank you.
So before we jump into radiology, can you tell our listeners a little bit about yourself and how you got into the field?
When I was in high school, I don't think that they prepared us as much as they do now for you need to start preparing for college, and all this kind of stuff. I just knew that, I wanted to go to college, didn't really know a whole lot about it. So when I was a junior, our guidance counselor called us into his office and said, well, what do you want to do when you get done with high school? And I was like, excuse me, I am not a senior. And he's like, we need to get some classes and, and all this kind of stuff. I was like, I want to wear comfortable shoes. And he's like, really? And I'm like, yeah. I don't want to dress up. I don't want to, have to wear heels or anything like that. I want to wear comfortable shoes. And so he was like, ooh, medical field? And I was like, ooh, I don't know if I can be a nurse. And he's like, lab or radiology? And I'm like, sounds great to me. And that was the other stipulation. I don't want to go to school for very long and I want to make some decent money. And so I was originally from Humboldt. Fort Dodge was just down the road. So Iowa Central was where we all went to school. I signed up for both because there was a waiting list. So I went to school for like a year, didn't know what I was really going to do, but took some medical stuff, anatomy and phys, that kind of stuff. And then I got accepted into the radiology program first.
Just kind of fell into your lap.
And it stuck and I liked it.
Well, perfect. So for those who might not be familiar, what kinds of radiology service does Boone County Hospital provide?
For a small hospital, really a lot. We have 2 dedicated x-ray rooms. We have 2 ultrasound rooms. We have nuke med, mammography, MRI, and CT. And we also do have bone density.
Okay, so all this talk machines, it's clear technology plays a crucial role in radiology.
Yes.
How has the radiology department evolved over the years in terms of technology and services?
So when I started 26 years ago, we used actual film, and you had to put it through a little processor and then it came out and we looked at our x-ray. And now we have 2 DR rooms, which DR means direct radiography. So if you take a picture, it's on a digital plate and then it comes up like immediately on the computer screen now. So no more film. We also have a PACS system that houses all of our digital imaging. And that's how we can look at our images, also how we kind of can send them to different hospitals and different clinics if the patient needs to be transferred to someplace else.
So lots faster now.
Yeah, lots faster. I think, it used to take us probably half an hour or so to finally, get everything done on a chest x-ray. And now it takes like 5 minutes.
Oh, that's awesome. Being able to see those advancements in technology and how far things have come.
Definitely.
Can you share some insight into the expertise of the radiology team here at Boone County Hospital?
We have 4 mammographers and we are board certified. So that means that we have to go do some more schooling after we get done with our general x-ray degree. The state of Iowa and ARRT, which is our accrediting body, you get a booklet and it's all of these things that you have to get done before you can sit for a board.
Okay.
And then you take a board and then you pass that board. And then every 3 years, we have to have at least 15 credits dedicated to mammography. So a lot of learning about different and new technologies, different ways to get the best picture that we can, ways to help our patients be safe. We also have 2 ultrasonographers that have gone on to, more schooling. One has her 4-year degree from the University of Iowa, and the other one went to South Dakota for her ultrasound degree. We have a nuke med tech. She also went to radiography school and then went on for nuke med. That's another 2 years. So a lot of education and a lot of CEUs that we have to do and continuing education that we need to keep up on because, as you know, the technology changes pretty quick.
Constantly.
So, yeah.
Just within your department, collaboration is key, but in healthcare in general, it's very important. So how does the radiology department collaborate with other departments and providers to ensure comprehensive patient care?
We are a diagnostic, so that means that we help diagnose for any diseases and any pathogens that are going on. We help the provider. They look at signs and symptoms and they think, oh, you probably need to have a CT. So then it comes to us, we do the CT, and then we get to see, they have to go see an orthopedic surgeon, they have to go see a surgeon, they have to go see an oncologist or something like that. So we kind of help in that situation, but we also collaborate with different departments. If we have a patient that gets sent to us for a procedure like a biopsy or a abscess that needs to be drained or something like that, we collaborate with surgery quite a bit because they help us give meds because we are not able to give those. We collaborate with the floor because sometimes after they get done with their procedure, they go up to the floor, stuff like that, where we have to kind of coordinate with other departments. When we do CTs, sometimes if your kidney function isn't very good and you have contrast dye, it will not be very good on your kidneys. So we have to kind of collaborate with the outpatient infusion center, and they usually kind of get some fluids to kind of help flush that contrast out and kind of help heal the kidney a little bit. So we work closely with a lot of different departments.
Okay. Always doing what's best for the patient, which of course is top priority.
Yeah.
So what are some ways that Boone County Hospital ensures a positive and comfortable experience for patients who are undergoing radiology?
I think patient comfort is really big. I do MR also along with CT and mammo. If we make the patient comfortable, the better pictures we get.
Sure.
So explaining is a lot of our job, explaining that this is why we have to do this is what it's going to feel like, this is what is going to happen. So a lot of people's anxiety is just not knowing.
Yeah.
So when they get here, if I feel like they have anxiety, I try to explain, because that helps to tell the brain, I'm not going to get hurt. Nothing bad's going to happen to me. I'm not going to be left alone. I'm here. We're taking care of you. There are tests that are not very comfortable, but we also explain that it's not going to be forever. You know,
Right.
It's going to be quick. We're going to try to get it done as fast as possible.
Is it the MRI,
Yeah.
the one where your like whole body goes in? That would be the one, especially if you're claustrophobic or something. How long does an MRI take?
Well, and it all depends on what you're having.
Okay.
But if you're doing any kind of body imaging like abdomen or pelvis or something like that, those are kind of probably be like an hour.
Okay.
If we do a head, those are probably at least 45 minutes. I always tell patients to book for an hour, but our imaging actually probably only takes about 45 minutes. But if we have to start an IV, or if you're a little antsy or anxiety ridden.
Because those you have to sit very still, right?
Yeah. So then we kind of have to go through that a little bit more, and it takes a little bit longer. I tell patients some of the abdomens that we do will be an hour and a half because you have to hold your breath a lot. And I want to give you plenty of time to hold your breath and then recover, because if we don't give you time to recover, then you're just going to hyperventilate.
Yeah.
And then we're not getting the exam that we need.
Can they listen to music or anything?
Yes. I think if you can get something that you can think about, something else.
Distract yourself with.
Then I think that's great. And we have a streaming service that we use. And so if you say, you want to listen to country or the 70s or 80s, we can pretty much find anything to listen to.
Music is very comforting. And
Yes.
It can distract you or help you relax.
Yes.
So are there any specialized radiology services or unique aspects at Boone County Hospital's radiology department that set it apart?
I have a lot of patients that can't get in down in Des Moines as soon as they can get in up here. I have a lot of patients that it's just too hard for them to get to appointments over in bigger cities, or they just don't have the time to go someplace else. So I love that we can offer a lot of services that a smaller hospital might not have. We have nuke med, and those nuke med studies, they can be heart studies, they can be bone scans, they can be gastric emptying studies. A lot of those are not from our providers. We get a lot of out-of-town providers that are specialists that are like, hey, my patient's in Boone and they want to get their studies done in Boone. So we have a lot of those things that we can do.
I think sometimes, like you said, because we're small, with any of the services that we provide here, people are like, oh, they're just a rural hospital. They're not going to do that.
Right. And we do have radiologists on staff every day, 8 to 5. So we have somebody here to read any of our images. And it's a huge asset to us too, because then we can also ask them questions instead of having to worry about, I'm going to call them and
hopefully I'll hear back.
Right. Also because a lot of small hospitals don't have that either. So that's big. That's really big.
Looking ahead, what can we expect in terms of future developments or plans for the radiology department at Boone County Hospital?
We are getting a new MRI. Yay. Which that is also be helpful. I think they say that we can do a brain in 12 minutes.
Wow.
Yeah.
So what's the old one?
Like 45.
Holy cow.
Yeah.
That's a big advancement.
Yeah.
That's awesome.
Yeah. So a lot of our stuff is going to take probably half the time that it used to, which means great strides for us because that means more patients that we can fit in.
So those numbers that you were telling me earlier of how long some of the stuff that'll cut down that a lot.
Yeah. A lot of those patients that are claustrophobic, it's only going to be 15, 20 minutes. So that's very helpful. We're going to hopefully start that end of February, beginning of March, and have it done by June. Hopefully sooner than June, but I know June is where we're, I think, kind of shooting.
Okay.
And then within the next couple years, we are going to be getting a new CT scanner. Our OB with the new docs that are coming on. I think our OB department is going to start to expand. That's another thing. We collaborate with OB on a lot of the ultrasounds.
Yeah.
OB, Nuke Med, I think that's going to kind of hopefully pick up with a lot of the heart scans and stuff that they're doing. Yeah. We just try to keep up with the technology. And I think right now we're sitting really good. We hopefully will keep on with the orthopedic surgeons that come. And we got new ultrasound machines 2 or 3 years ago.
Most of the services that you said, like it's either just been or it's going to be new.
Right. I mean, that's one thing that we kind of always have to think about with radiology. In the past, I would say 10, 20 years, it has grown in leaps and bounds. Everything needs to be updated pretty quickly. And so it's not like back in the old days when we could have a room for 15, 20 years and it be still the same technology.
Right. Which is good that it's evolving so quickly because it's just getting better, but then it's also
money.
Yeah.
I do feel that it's services that I think that Boone could use. And that's huge. I like that we can offer that to those patients.
Absolutely.
And,
do you guys have 4D ultrasounds?
Yeah, they don't do them a whole lot. I think they try to only use it like when they do their 20-week scans.
Okay. I think I only had it done like once. It's harder, isn't it? Especially if the baby's moving.
Yeah. And so usually you would have a 20-week ultrasound, which is you're making sure that everything is growing like it's supposed to and make sure that there's no abnormalities or anything like that. And everything's good to go for the 3rd trimester. Okay. So if they can get all of that stuff done and they have time, then they will go ahead with the...
Is 4D more for...
It's just for you
patients.
Guys.
Okay.
Yeah, it's just for...
Because you do everything's done on the normal measuring and all that stuff.
Yeah, we do our normal in just a normal 2D imaging, and then the 4D is just something extra. Those are fun to have. I'm glad we have that, but we also have to make sure that we're getting what we need.
Yes, because I think some people, the place I'm going has 4D ultrasound. And I think some people, I don't want to go there. They don't have 4D ultrasound, when really what's important is what you guys need to see on your end, not the 4D ultrasound. Yes. It's nice. That's not what helps you guys do your job.
No. That's something that we like to have. Yes. But it's not something that you have to have.
Sure. It's one of those patient perks.
Yeah. The one kind of like the patient perks that, like we have in-house OB. A lot of places don't have that anymore. The fact that we're a big enough hospital to have all of those modalities and we have all of the stuff that we can offer in radiology, but we're also small enough that I remember my patients and I remember what we did 2 weeks ago.
Yes. And as a patient, that makes you feel better too.
And it might not be the name I remember, but it might be just the situation that they're in or the situation we had when we did the exam or something like that.
Well, thank you so much, Amy, for providing valuable insight into the radiology services here at Boone County Hospital. Before we wrap up, is there anything else you'd like our listeners to know?
Come to Boone.
Yeah, come to Boone.
Yeah, we have great staff. We have a lot of great things to offer our patients.
And there you have it, folks. A glimpse into the world of radiology at Boone County Hospital, thanks to the expertise of Amy Bachman. It's been a pleasure having you on the show.
Thanks, Rachel.
If you have any questions or want to learn more about our radiology department or the other services we offer, visit our website at www.boonehospital.com or find us on social media at Boone County Hospital. Be sure to like, subscribe, and stay tuned for our next episode. Until then, stay informed, stay healthy, and keep the conversation going with Healthy Talk.